This is a seasonal health alert for wildfire smoke from the Washington Poison Center.
Unfortunately, due to events occurring in the state of Washington right now, we now have a talk on wildfire smoke inhalation. I have nothing to disclose. So first off, let's talk about some current wildfire stats. This is, as of this morning, there are 102 large fires being suppressed across the United States. Unfortunately, fire activity is pretty concentrated in the Northwest right now in the United States, though, as is always the case, there are wildfires across the country. And just within the last week, we have 7 new large fires, several of which are in the Pacific Northwest region. We have so far in 2026 had more than 3 million acres burn. And if we look back over the past couple years and extending back decades, we do see this pattern of wildfires, unfortunately, increasing in the number that we get at one time, the frequency at which they pop up, the size that they obtain before they are fully controlled, and the intensity at which they burn. And unfortunately, that is a pattern that, at least at this point, we expect to continue to worsen. So, with all that being said, wildfires and wildfire smoke is something that we are going to continue to grapple with this year, next year, and for the remainder of, my life in the Pacific Northwest, I fully expect. This was this morning's air quality map for the United States, and unfortunately, we can see there are fires dotted across the continental US, but the Pacific Northwest is taking a beating right now with its air quality. If we zoom in a little bit, not just Washington, but a little bit of the surrounding area, and we compare this to the US Air Quality Index, we can see that unfortunately the majority of Washington right now is unhealthy at the very best in its air quality, extending into hazardous. And we're going to go in a little bit into what that means, what actually makes up the air quality index, and what, if anything, we can do for ourselves and advise for our communities to try to lessen the harm that air quality takes and some of the negative side effects of that wildfire smoke. So to start with, combustion, pretty straightforward. We've got the fire triangle here for anybody who was in scouting or might have seen it elsewhere. Fire is an exothermic reaction, not a surprise. You need something to burn, something that will oxidize, and we happen to live on a planet with 21% of our atmosphere being an oxidizer, so we got plenty of that, and some sort of heat of activation. Now, this talk is really going to focus on wildfires. So the heat of activation is, unfortunately, it's usually humans. So this could be a cigarette butt, an untended or not fully extinguished campfire, matches, lighters, something like that. And the remaining 10 to 15% is naturally occurring fires, which is most commonly lightning. Smoke inhalation. There's a lot of things that make up smoke. They are particles, fumes, and gases. When we think about house fires and kind of enclosed space fires, we really tend to worry the most about carbon monoxide and cyanide. That is what causes the majority of fire-related deaths in burning houses is inhalation of those chemicals. Um, we worry a little bit less about, cyanide when you're thinking about a wildfire, simply because you're not in an enclosed space. You have the entirety of the atmosphere. And we see a lot more issues with the heated particulate matter of the smoke. We're going to talk a lot about particulate matter in terms of its sizes, because that affects where it goes once we breathe it in and sort of where it might be having its effects. The particulate matter sizes that get talked about the most are 2.5 and 10 microns. So you could think of that as like fine and coarse particles, black carbon, and then many, many other chemicals, but things like benzene, formaldehyde, even heavy metals can be included in wildfire smoke. So whenever we think about what makes up smoke, one of the first things that we have to ask is, okay, what was our fuel? Because obviously the production of the smoke is not going to magically contain anything that wasn't, molecularly involved in the chemical processes. So whatever makes up the fuel that gets oxidized, that undergoes its chemical reactions, that's going to determine what's present in the smoke. You certainly don't need to memorize this table. This is just to give you an idea that a lot of the products that we have as human beings that are just sort of around our homes in our daily lives make a lot of different components for smoke. When we think about wildfires happening in the mountains, obviously the vast majority of what is being burned is wood. But as those fires start to come into residential neighborhoods, unfortunately, we are burning a lot of man-made structures that contain plastics and PVC and both natural and synthetic materials. So the smoke is obviously a really, really complex mix of components. Uh, the particulate matter we've got on our the right side of the slide there, just a very, very simplified diagram of the airways. To give you a sense of scale, the human hair is like, depending on how fine your hair is, around 50, 70 microns in diameter. Our PM10 molecules, those are the larger ones. Those tend to deposit higher up in the airway when I take a breath of that smoke. They don't make it all the way down into the bases of my lungs. It also contains not just the like combustion from whatever was burning, but also like dust and like very, very, very small soil particles that are kicked up from exposed dirt, from construction, from industrial processes, and from disturbed ground during wildfires. Uh, Dropping down in size by 4 times, the 2.5 microns, those are able to travel much deeper into the lungs. When you take a deep breath in, they are smaller, they whisk all the way in. Those tend to be coming directly as the products of combustion and not debris as well. And then submicron particulate matter, so less than 1 micron in diameter, those are able to make it all the way to the end of the airway trees, little sacs that are called alveoli. And those are actually even able to pass into the bloodstream. What we think of when we're calculating our air quality index, those we measure our 10 micron and 2.5 micron particulate matter. Unfortunately, right now, submicron particulate matter is not part of the air quality index. Some researchers have advocated for that to change, but as it currently stands, the air quality index, which is a publicly available tool from the federal government, doesn't measure those. So if you are breathing in this particulate matter, what kind of impacts does that have on the individual? Like I said before, smoke is really, really complicated, so it's hard to pull apart, which element of the smoke might be causing which particular health effect. But we know that particulate matter inhalation has been linked to premature death in anyone with a heart or lung disease that's already been diagnosed. It increases the rates of heart attacks, non-fatal heart attacks in some studies, increases the rates of irregular heartbeats. Obviously, I don't think it's going to be a surprise to anybody, increases rates for asthma or COPD exacerbations. If you have completely normal lungs, breathing in smoke will decrease your pulmonary function. And regardless of the state of your lungs, breathing in smoke leads to inflammation, irritation, On milder days, that might be just a scratchy throat or a cough. And as you get higher and higher levels of smoke, worse and worse air quality, that can lead to wheezing, chest tightness, feeling like you're not able to take in a full breath, and honestly, some pretty significant respiratory irritation. So without us necessarily being able to pull apart, for any individual who comes into the emergency department, what part of the smoke harmed them, what we do know is when we look at days of where communities are exposed to high levels of smoke, all age groups have increased visits to emergency departments for respiratory related complaints. So it's not just your very old patients with COPD. It's not just your smokers. It's not just people who have diagnoses of asthma. It is across all age groups. We do see the biggest impact, or at least some studies have seen the biggest increase in ED visits for people between 19 to 64. And not all of them had any pre-existing respiratory or heart complaints. Interestingly, we've also seen a increase in the odds of like a cardiovascular visit to the emergency department, so some kind of issue with your heart, but it doesn't necessarily happen like on the day that you are exposed to smoke. It can be delayed by several days. And a separate study looking specifically, I believe, at Seattle Children's Hospital found that there was a 7% increase for hospital admission for any reason on days with high wildfire smoke exposure. Now, we do know that children can be uniquely susceptible to smoke inhalation. They have a higher minute ventilation, which just means that they're smaller than adults, and for their size, they breathe more air than a larger adult does per minute, which means that if they're breathing in air with smoke, they are getting more of that impact per pound of their weight than an adult. We know that there's, I mean, certainly today, a lot of smoke in Washington, but also that Washington and the Pacific Northwest, and honestly, the West Coast in its entirety, is at a higher risk of having smoky days and potentially having more and more of them as we go forward into the future. So, what can we do to lessen the harm that our communities face from breathing in smoke? Unsurprisingly, I think the first step is community risk education and outreach. Some other things that we will talk about in the next coming slides is understanding what is the EPA's AQI and how can we utilize that? What is the value of masks? And what is the value of filtering home air? So I think one really important message when we're thinking about community education when it comes to smoke inhalation is the message that we want to send about who is most susceptible. I do think that part of the message should be that everybody is susceptible. If you are alive, you are breathing. And if smoke is going into your lungs, it is not good for you. There's a lot of studies that back up that you can be young and healthy and not have any diagnoses, and breathing smoke is still bad for you. But specifically, those who already have diagnoses of lung disease or heart disease, they are at a higher risk of fatality from complications with those diagnoses. Some studies have also found that people with diabetes are at an increased risk. However, it's a little bit hard to pull apart the fact that people with diabetes are also at an increased risk of heart disease. So, is it the diabetes or is it the fact that a lot of people with diabetes unfortunately also have heart disease? I'm not sure. It seems like maybe it's the heart and lung, but I think there is still ongoing research in that area. Even for those who haven't been diagnosed specifically with a heart or lung disease, older adults And maybe some of that risk is coming from the fact that they actually do have heart disease that just, they've never had a stress test or an echo and they don't know they have heart disease. But in general, when we look at our geriatric community, their health is just more frail. They've got less of a physiologic reserve. So, what we think of as like an insult, an event that damages their health, like breathing in smoke on a really bad day, while that might make a 25-year-old just kind of feel crummy, if you're already very frail, that might be enough to cause a more serious issue. So letting our older adults know that they are at a higher risk. And then children. First of all, their lungs are still developing, so we certainly don't want to cause any long-term, reactive airway exacerbation issues. Uh, Children, on the whole, have higher rates of asthma and acute respiratory illnesses than adults do. So that's more likely to have negative outcomes when mixed with smoke. And also, at least for a lot of the children I know, they spend more time with high activity levels than adults who maybe are a little bit more sedentary with their lives. And we do know that if you are exerting yourself and doing high levels of physical activity out in an environment with smoke, that leads to um, more inhalation of the smoke and more severe effects of the smoke inhalation. So I would say that was probably the groups that I would want to specifically reach out to and educate that, this is a higher risk for you. When we are doing our education and talking with communities, I think letting people know, first of all, that the air quality index exists, that it's even a thing. This was developed by the Environmental Protection Agency. It's to be a tool for state and local agencies to watch the quality of the air, but this is something that is freely available to the public as well. The AQI looks at a number of common pollutants. And in your day-to-day life, when there isn't a wildfire happening, a lot of the big components of this air quality index are things like sulfur dioxide and nitrogen dioxide and ground level ozone and carbon monoxide. But in a wildfire, the aspect of the air quality index that really just accounts for the mass amount of the score is the particulate concentrations. And like I mentioned earlier, the sizes that are measured and are incorporated into the AQI are that 2.5 and 10 micron size. So unfortunately, we don't really get a measurement of how bad submicron pollution may be. However, day to day, this is still pretty good information and it is available at all times. I had those pictures at the beginning of the presentation. You can go look at AQI maps that are, up to date the last couple minutes for anywhere in the United States and for many parts of the world, honestly. So, what can we do with that information other than looking at pretty and colorful pictures? Well, first off, I would like to apologize for our colorblind members of the audience. These are the colors that are sort of officially associated with the AQI. I don't know how they look for the folks in the room who may be red-green colorblind or fully colorblind. But we've got our AQI going from 0 to greater than 300. And you can see that there's health advisories that are associated with that level of AQI. This is something that's very easy to disseminate to the public, something that's pretty easy for them to check and then potentially modulate their behaviors based on the AQI for their particular region. Unfortunately, as I mentioned at the beginning of the talk, that a lot of Washington today is in that level that is a greater than 150. And as we can see, the advisories for that is saying that, people with heart and lung disease, older children and adults, the older adults and children, those susceptible groups I mentioned before, should be avoiding exertion. If at all possible, they should be indoors in an area that is preferably got filtered air. Um, and for the folks who are in the very affected regions, ideally, everybody is avoiding prolonged and heavy exertion outside. So bringing in this kind of information allows the community to like potentially time their daily activities on smoky days. So you can plan outdoor activities such as, maybe you want to go for a walk instead of a jog. Maybe you want to fully cancel your walk. Um, when you are not immediately next to a wildfire, there's daily fluctuations. So, for example, you may have a worse air quality index at like 5 in the afternoon, but it may go back to a healthy level at like 8 p.m. So maybe that's somebody with a history of asthma wants to wait a couple hours before they go outside and go to the park. So this allows the community to kind of take a little bit of proactive action to minimize their exposure. Unfortunately, if you are in a place that is in direct proximity to a wildfire and your air quality index is greater than 200 24/7 for the duration of the wildfire, it's not as though you can time your exertion or time your walk to the park. Uh, so if you're in that situation, what can you do? So, I want to talk about masks, and I think it is important to point out that this is not the same as when we talked about masks for COVID-19. The strategy that we're trying to accomplish is just different. So, when we're thinking about trying to prevent the transmission of an illness, like surgical and cloth masks are able to stop droplets, but they can't stop smoke particles. They're simply not good enough for that. If you're trying to stop smoke, you really need a tight-fitting mask, not something that's just sort of like draped across the face. And you're trying to stop something ideally at least down to the 2.5 micron size, and preferably even smaller than that, which does mean you start needing to think about really specific types of masks. This is probably also an area where we can actively improve our public health education. Because I gotta be honest, I don't know how much the general public knows about mask types. Probably a lot more now than 10 years ago, since we are post-COVID. But I think the general population still maybe only thinks about like surgical masks and then maybe an N95. So the next couple slides, I'm going to talk about like really optimized mask choices, which might be really good for like people who have occupational frequent exposure and might be worth like simplifying the message if you're trying to talk to like a general community. Because the specific mask you want to choose does depend on how far you are from the fire and how long the fire has been burning. So some of the things I'm going to be talking about is like early fires, mid fires, and aged fires, by which I mean like a fire that just started burning or the area that is on fire just started burning if we're talking about a wildfire that's been going for a couple days but has spread to a new area. Mid fires, they've been burning for a little while. The smoke has gone up into the atmosphere, and then over time, that fire, those particles are kind of coagulating in the atmosphere. So incredibly small, ultra fine soot kind of globs together to form a larger particle, though it's still pretty small. And then aged fires, it's been going for a while. The smoke has been in the atmosphere for hours to days and has continued to kind of coagulate into larger particles. And then when I talk about proximate zones, I mean you are very near a fire. I'm expecting that those people are likely having occupational sort of exposures because otherwise, if they are a member of the public, they probably should be evacuating rather than being directly next to the fire. So Here's a couple tables for this slide and the next one. So we're looking first at the early and mid-stage fires, and you can see that the particle size as that fire ages and that smoke has been up in the atmosphere for longer, those particulate sizes are going to get bigger and bigger and bigger. We start out with this incredibly small, ultra fine soot in the first, initial burn. And that is almost all of the particle count is this incredibly small, like less than half a micron in diameter, little piece of particle. And if you want to have a mask that's going to help with that smoke, ideally you're looking at like an N95 or a P100. Um, and I do want to say that the pictures on the side there, I am not advocating for any particular brand. These are just some example images. You also can get both reusable versions and disposable versions for a lot of these masks, like the one down there with the pink filters. That's obviously reusable where you can buy new pink filters, but the R95 below it in the very bottom corner is a disposable version of the R95. Um, so anyway, for the very early fires, we're thinking like N95 P100. That'll get that really, 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 really fine, fine soot. You really want to have one that comes with dual straps because any kinds of gaps around the face, that super tiny soot is just going to go around the mask. Um, After that smoke has existed for, a little while up in the air, those tiny particles start coming together, and now we are increasing to like half a micron. And at this point, you know, P100 is a little bit better for the oil mists. They stick into the filter better. As the smoke has stayed up in the atmosphere maybe for days, you are now, looking at uh, N95 or a P100, again, two strap to avoid any gaps around the face. And if you are, working directly next to where the fire was, which is not necessarily just a firefighter, also could be a community member who is going back to their neighborhood after the fire has passed through, and now they are digging through, you know, perhaps they lost their home and they are trying to find things, or they didn't lose their home, but they're trying to clean up their property. Uh, they're going to be exposed to a lot of ash. And as you can see, the ash is by far the biggest particle sizes. If you are in there moving things around, you're going to be exposed to very, very, very large amounts of that. The good news is with the ash, any of the NIOSH respirators will be able to stop those bigger particles. But if you don't have a respirator on, you're going to be exposed to huge amounts of it. So really important to be wearing a respirator in those situations. I'd say if you're trying to like dumb that down to a much, much shorter message, if you're talking about like downwind community safety and you're not next to the fire and you're not next to a fire that has just started, a NIOSH N95 is probably going to do the job pretty well. You want to make sure you've got one that has two straps and fits on your face well. If there's big gaps, get a smaller size. If it's kind of pinching up when you open your mouth to talk, you want to get a bigger size. And if you are in intense, like close proximity to either a fire that's actively burning or into an area that has had a fire move through, you want to have preferably a P100 reusable respirator. I would say also part of that message that I would want to communicate is don't rely on the masks that became popular during COVID. Surgical masks, cloth masks, bandanas, dusk masks for people who are, like doing stuff with drywall around their homes. That's not going to block the particle size. That's really going to make you sick. Let's say that you've got somebody who's in one of these areas that's got a really, really, really high unhealthy AQI, and you know, they're not going outside for a jog. They're not doing anything. They're just trying to minimize their smoke exposure. How can they make their home a safer place for them to live, for their children to live? There are home air filtration strategies. Some of you guys may have heard of these. They became popular a little while ago, and I think are continuing to get spread around online. They are highly effective. They are sometimes called CR boxes, standing for Corsi Rosenthal, or MERV 13 boxes, which uh, the MERV 13 is a kind of air filter. This is a do-it-yourself design, so anybody is able to go buy these supplies and make them themselves, and they are pretty cheap. So the idea is that you want to use somewhere between like 1 to 4 of these large MERV 13 air filters, and you use a box fan and you put them together with tape. So, if you can make an IKEA uh, desk, you can definitely do this. Not super complicated. They are incredibly highly effective for decreasing the 2.5 and 10 particulate or micron particulate matter indoors. And they're actually pretty decent at the submicron particulate matter as well. If you want to make the full cube with the 4 filters and the box fan on top, costs about $50 for a set of filters and $20 for a box fan. If you want to make one that just has a filter directly attached to the back of a box fan, I think it's about $15 for 1 filter. So this is a price that is like it's a price point that is achievable for a lot of households. Um, there are a ton of instructions online, and there's instructions available in different languages as well. So this is something that is pretty accessible to the community. Uh, and there's been some research that's been done on like how long these filters are good before you have to change them out. And this was looking at their effectiveness over 10 months. And you can see there's a little drop in efficiency, like about a 10% drop in efficiency between 6 and 10 months. So if you were going to make one at the beginning of like a wildfire season and just have that going for the whole wildfire season, you would not need to exchange for new filters. Um, this is a pretty cost-effective strategy. And you can see even for that like 0.3 micron size particulate matter, you're dropping down to like 50% effectiveness, but that's still way better than nothing. HVAC systems typically, unless you have these specific air filters as part of your HVAC system, your home air conditioning system may not be doing this kind of filtration. And honestly, the majority of homes in the state of Washington don't have AC. So, they don't have any filtration at all like that. So I do think that letting people know about options like do-it-yourself MERV 13 air filtration devices for inside of the home is something that a lot of people could benefit from. Um, in in summary, as I don't think is going to be a surprise for anybody, the number of wildfires is increasing in number, in size, in frequency, and in intensity, and they are sort of disproportionately occurring on the West Coast, which has certainly from this past winter been very dry, not a lot of snowpack, uh, and projected to have some pretty bad wildfire seasons in the coming years. Wildfire smoke is harmful to those who are exposed. A lot more research needs to be done on exactly what's going on within the components. But at the end of the day, it's not as though you can wave a magic wand and remove the benzene or remove the submicron particulate matter. Our patients and our community are going to be exposed to the smoke as the whole, and we know that that's going to have negative effects on them. Public health outreach, we can let people know how they can monitor the air quality in their area, how they can change their day-to-day activities in response to worsening air quality. Let them know what the recommended masking is for different things that may be going on in their lives, and let them know that there are ways they can filter their indoor air, particularly if they are in those very affected areas. Thank you so much.